So, hello everyone. My name is
Hi.
Hannah Frazee, and I am a programming librarian here at Cary Memorial Library. First, I'd like to thank the Cary Library Foundation. Their support allows us to run incredible programs like the one we will be having tonight. This program is being recorded and will be posted to the library's YouTube channel. So if you have any questions for our speaker, or if you have any questions for our speaker, please enter them into the Q&A and we'll have some time at the end to discuss those questions. And before I introduce our guest, I would like to mention that we are partnered with Senior Services for this program. So we have Michelle Kelleher, the Senior Services Director, joining us tonight, and she would like to share some information about what they do and the support they provide to the community.
Thank you so much. As you mentioned, I am the Senior Services Director for the town of Lexington. I appreciate you collaborating with us, Hannah, on this program. As part of my role, I have the privilege of working with caregivers in our community and facilitating caregiver support groups on Zoom. These groups are a wonderful opportunity for people to connect, share experiences, and find support in what can often be such a challenging journey. I also want to take a moment to mention that we are going to be hosting another program on November 20th at the community center. It's an in-person event. It focuses on caregiving resources and policy. We're going to be joined with Senator Cindy Friedman at that event and the Alzheimer's Association. So we hope everyone can join for that event, and I'll put my information in the chat as well as the information on how to sign up for that program. Thank you.
All right, thank you so much, Michelle. And now I would like to introduce our guest. Dr. Evan Plys is a licensed clinical psychologist, board certified in geropsychology. He currently is an assistant professor at Massachusetts General Hospital in the Center for Health Outcomes and Interdisciplinary Research and within the Department of Psychiatry at Harvard Medical School. He is also the co-director of the MGB Caregiver Clinic, which provides psychotherapy services for caregivers of persons with dementia and other neurodegenerative illnesses. His funded program of research investigates psychological intervention and approaches for post-acute and subacute residents, as well as their family care partners during a skilled nursing stay. And his research also extends to targeting care partners of persons living with dementia and has published extensively on this topic. And now I will turn the floor over to him.
Thanks so much, and thank you for having me. I'm going to share my screen, and thanks so much. Yeah, thank you again for having me. I'm really happy to be presenting, and definitely want to leave some time at the end for question and answers. I also want to put out the caveat that I am in my research and my clinical work. I really work primarily with folks living who are caring for somebody living with a neurodegenerative condition. So things like Alzheimer's, Parkinson's, ALS. Although the stuff that we're going to talk about today really generalized to anybody who's caring for a family member. Whether that's somebody with a neurological condition, a chronic condition, none of the above. This stuff does translate. So I'll present some data and talk about some stories related to dementia, but again, this really should generalize to caring for anyone in the family or close to the family. So I'm gonna get started by presenting a few facts about caregiving. So when I say that I work with folks who are caring for someone with dementia, the first thing that I hear is how hard and stressful that is. Like, oh, that is such a hard thing and a really stressful journey, and it is. You know, people who are caring for somebody with dementia have really high emotional, financial, and physical burden. So more than half of people who are in this role are saying it's high or very high emotional stress. And we even see way higher rates of clinical levels of depression and anxiety than the regular population. So there is something about this caregiving role that is really highly emotionally stressful. And that is serious. It's not just having a stressful day. It relates to about 1 in 3 caregivers along the journey have thoughts about harming themselves. More than 1 in 4 do neglect their own health. And we see that relatedly, caregivers have a 41% higher odds of developing their own physical health challenges while caregiving. So these stressors in this role can really have an impact on the caregiver's health and well-being. And that's not a fully balanced view of caregiving. And I think it's really important to set the tone because we are going to talk a lot about stress and emotions and the challenges of caregiving. And it's really not all bad. People tend to not stick in roles that are all bad. So there's a reason why people are caregiving. And almost half of people find it very rewarding. The most, they max out the scale on how rewarding caregiving is. I've heard so many stories about people who are in this role and they feel a sense of purpose. They notice growth in themselves. They develop new skills that they didn't know they had. They notice that their other relationships get better, and their relationship with the care recipient gets better. I was recently in a group that I run, and someone said, as a caregiver, I achieved a deeper level of love than I knew was even possible. So again, this is a journey that, yes, it's stressful, yes, it's hard, and it's really beautiful. And so I think I really want to maintain a balanced view of that, as to not like feed into the doom and gloom. The other thing is, even though it's a really hard journey and there's a lot of really real clinical levels of mental health and physical health burden with this role, at least on the emotional side, we know what works. Like we have a lot of treatments available that help people navigate this journey. Now, one of the things that so I do psychotherapy. So I work with people to help alleviate their depression, anxiety related to the caregiving role. And, we have a lot of interventions, a lot of models that we know when people get this type of treatment, they improve. Their levels of depression, anxiety decrease, their awareness of all the positive aspects increase. So we know what works, and people have been studying this for 4 decades now. It's mostly about getting these interventions to people. And the other thing is setting realistic expectations. These interventions are not designed to make you not feel any of these emotions. Unfortunately, I know that would probably be great if you never felt sad in this role. And these treatments are really designed to help people not escalate to the point of having that sadness affect their own health. And so I'll talk about what some of those treatments look like in a little bit. And these are just some quotes that I pulled, again, really trying to emphasize that the caregiving journey is really one that is done out of love. It helps people develop a deeper love, and it has a lot of positive aspects in addition to being really, really challenging. And I think that, again, we don't want to lose sight of the fact that this is an incredibly rewarding journey as well. All right, I want everyone to take out a pen and paper. I can't see you, but I will sense if you're engaging with me or not. So I'm gonna ask a couple things, and you don't actually have to write it down. You can just kind of think to yourself, but I want to pose a couple questions to the folks who are on the call. If you're in a caregiving situation, if you're caring for a family member, or even if you're thinking about what that would be like in the future, I want you to first reflect on who do you consider to be a role model for being a good family caregiver or care partner. I'll use those terms interchangeably. So I want you to think about, who is your role model and what attributes do they have? Like, what are the attributes that really make a high quality family caregiver? And this can be someone in your family, someone in the media, someone at a support group through the councils on aging that you connect it with, that you're like, wow, Michelle is such a role model and a beacon of hope, and I want to be like her. Just take a few seconds and really reflect on, who is that role model that you're striving to be, and why? Like, what are the attributes they have? And I'll give us about 30 seconds to think about that, because in real time, 30 seconds feels like a lifetime. Okay. So just make a note of that, and then we'll come back to this in a little bit. All right, exercise number 2. Here's another one. I'm gonna describe a scenario to you. So I want you to imagine that a friend of a friend contacts you because they're caring for a spouse who has dementia. And they say that they're at their wits' end, that they're so stressed, that they're having a hard time being nice to their spouse, that they're kind of snapping at their spouse. They're maybe getting a little mean, a little short. Maybe they raise their voice every now and then. And they also feel some resentment towards their spouse. They're like, I love them, but I'm giving up so much of my life for them, and I'm feeling a little bit of resentment towards them and towards the situation. And they feel really guilty about that. They're like, I just feel really ashamed that I'm feeling this, feeling really guilty. I need to calm down. I need to be nicer. I need to do all these things and be selfless. And why am I so hung up on things? And they tell you that they're just feeling helpless and overwhelmed. So I want you to think of how you would typically respond to somebody in this situation. Thinking about kind of like, what tone would you talk to them in? What might you say? Just, your gut reaction to somebody who comes to you saying that they're feeling frustrated, resentful, guilty, and overwhelmed. Now I want you to think about a time, or think about yourself in this situation, where you maybe lost your cool and got upset, or were not, quote, being nice to someone that you're caring for, and that you lost your cool and felt upset and got really overwhelmed. And think about how you typically respond to yourself in this situation. Same thing, thinking about the tone that you would talk to yourself in, what might you say, um, what is the language that you would use to talk to yourself? And also, how would that differ from another person? So typically, we see that folks are much harder on themselves than they are on other people. I think there's a very small percentage of people that would be like, oh, I would let myself go, but I would really lean into this stranger who are coming to me for emotional support. We tend not to do that, tend to beat ourselves up though. We tend to have very high expectations of ourselves when we're able to cut other people slack. And we'll talk about that in just a minute. So this process that I was describing is the most common referral question, I guess, that I see in my clinic. So you think of it like, say you're caring for somebody and you make a mean grilled cheese. They love grilled cheese. You make them lunch. You make a beautiful grilled cheese sandwich for them. You're feeling really good about it. You just made their day. and you put it down and they say, oh, I don't like grilled cheese, even though you know that they do like grilled cheese. And you know it's their favorite lunch, and they say, oh, I don't like it. And then you get frustrated. And maybe you get angry, maybe you yell, maybe you start to come up with scenarios of, oh, this person's giving me a hard time. This person's being manipulative, or they like to see me suffer, or something like that. So you get frustrated. And then later on in the day, you think, God, how can I get angry? This person has an illness. They have dementia, and I'm angry at them. I know that they just didn't make the connection with grilled cheese. I know they have a cognitive illness. So I must be really unfit for caregiving. I must be crazy, unhinged, a bad person, a bad spouse. And now I feel really guilty and shameful. And I continue to beat myself up. And I think I really need to get help, or else. And then people come to see me. And I think this is really embodying that, not giving us a break. How we might react to another person might be very different. We might not go through that process of feeling guilty and shameful and beating ourselves up and making all those judgments on ourselves when we have a fairly normal reaction to people. I know if I know someone to be a fan of grilled cheese and I make a great grilled cheese and they tell me they don't like it, or they, don't appreciate my grilled cheese, then I'm going to get a little frustrated. That's a normal reaction. It's that secondary process that, again, is really where we're judging ourselves a lot. We're holding ourselves to very high, maybe unrealistic standards. And I think for people, what I tell them is, this is the difference between a caregiver, a family caregiver, and a nurse. Because if I'm at the nursing home and I observe a nurse give somebody a meal, and they say, I don't like the food on this table, and they get really upset, and they're like, oh my gosh, you never like it, and they like really lean into this person, I'd say that's kind of bad nursing. That's not how we teach it. That's not good. But that's a different standard that people are held to, because they don't have decades of relational history with this person. Another thing I tell people is, if you were a nurse and you're in the hospital, you're an ICU nurse, and your spouse comes in, they're not going to give you your spouse as an assignment, because they know there's a conflict of interest there. So what is challenging when people inhabit this caregiving role, they say, okay, now I'm a spouse and I'm a nurse, and I'm holding myself to the professional standards of both. I have to maintain all the things that I do as a spouse, and I have to now maintain all the things that somebody who's taking care of somebody, a caregiver or a nurse, would do. And sometimes those things are at odds with one another. And so we can get these really unrealistic expectations. And when we're really rigid about that, it can lead to some of these judgments about ourselves. It can lead to more stress. It can lead to more emotional turmoil, because we're, again, setting ourselves kind of up for failure. So I want to talk about this concept called, here we go, self-compassion. So what we're talking about here is self-compassion. And there's a psychologist who I believe is at University of Texas, Kristen Neff. She's done a lot of work on self-compassion and thinking about what are the components of self-compassion, treating ourselves well. And so she came up with these three kind of buckets of when we're being kind to ourselves, when we're being compassionate to ourselves like we would another person, we are hitting on these three kind of key areas. So the first one is self-kindness. And when I think of self-kindness, it's kind of like the golden rule in reverse. So just as like do unto others as you would want them to do unto you, do unto yourself as you would do unto others. Like in that situation, in scenario 2, approach yourself with the same kindness and understanding and slack that you would the friend of a friend. So not being so hypercritical and really giving yourself the same amount of kindness as you would another person. So when we can do that, we're more self-compassionate. But that's not the only thing. There's also this component of common humanity. And so this is that the concept of recognizing that all humans share an experience. So in reality, every person who's caring for somebody is unique. There's no way, just given that you have two people with their own histories and their own experiences in life that have a relationship that also is a history and also is experiencing life and has this specific illness with this specific cluster of symptoms that interact with the histories and blah, 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 blah. There is no way statistically that two people's situation is exactly the same. So in that sense, yes, we're all unique. And when you say I'm sad, I know exactly what you mean. I might not be in that exact same situation, but I know what sadness is. Like I'm a human. I get it. I know what guilt is. I know what anger is. These emotions that we have are part of the human experience. So yeah, when somebody comes to me and is like, I want to not be sad all the time, I'm like, well, I could give you a lobotomy, and you could never feel anything, but I can't just isolate not feeling sadness because that is a normal human reaction. And that is something that everyone on this journey who's caring for somebody is going to feel. They're going to feel loss. They're going to feel frustration, doubt, guilt, all of the things that is shared amongst us. And so just recognizing that all humans feel these feelings, all humans make mistakes, and all humans require help at some times. Just the same things that you would expect an other person to need and to ask for is you as well. You are in that group of humanity. And so recognizing that it all boils down to a common human experience. That's the second bucket. Now, the third one is Kristen F. talks about mindfulness. And I'm going to amend that a little bit to say just stopping the negative spiral. So if we go back to the slide here, we want to stop the stuff on the right. So I can be in this situation, I can have this response, but then there's this spiral of the secondary. I'm blaming myself, I'm guilty, I'm shameful, I'm bad, I'm judging myself. That's the spiral that we want to avoid. And so we want to stop that through not getting so hung up on those negative thoughts and emotions. It might be, you know what, maybe it's not ideal to yell at the person you're caring for over a grilled cheese sandwich, but it happened. I understand why it happened. I can move on from it. I can learn from it. I can process it. We want to make sure that we're stopping from spiraling out to making things bigger than they are. And so when we're hitting on all three of those, that's self-compassion. And self-compassion is good. So self-compassion, caregivers who report higher self-compassion have lower emotional burden, lower risk of burnout. They use healthier coping strategies like self-compassion that also breeds a bunch of other healthy coping strategies. They're mentally more healthy, physically more healthy, and have more confidence as a caregiver. And so these are all outcomes that we want to achieve. So that's it. Go, like, be self-compassionate. You're welcome for the advice. You should take care, you should treat yourself better. I've done my work here. My work is done. You can go live a healthy life. Obviously kidding, because way easier said than done. Of course we want to be nice to ourselves. Like, this is not groundbreaking, not like we know this, and yet we still beat ourselves up. So I want to think about what are some of the things that get in the way of us being self-compassionate towards ourselves. The first thing I had you do, the first exercise was I had you fill out who your role model was. And I can't see hands, but it would entertain me to know that people were raising their hands. So by a show of hands, how many people said being selfless? How many people said patience? How many people said enduring endless love? These things that are wonderful, great qualities, that when we get too rigid and we don't see that there's nuance to all of these things, we can really begin to judge ourselves for them. So again, it is great to have role models. It is great to highlight the attributes that we want to be. Being selfless is fantastic. Being patient, a wonderful quality, and unrealistic to think that you will do that 100% of the time. One of the things I hear a lot from people when I ask them, like, who's their model of a caregiver, a lot of times people will say, like, oh, my parent or my grandparent, took care of their spouse, and my grandmother took care of my grandfather who had dementia, and she was amazing. She was so selfless. She gave up her life for him, took care of him, never complained, just took it in stride. And I'm like, one, that doesn't sound that great. Also, is it possible that your grandmother just didn't want to air out her dirty laundry with her 10-year-old grandchild of how miserable she was or how frustrated she was, or all of these things? So I think that we internalize these messages. We also internalize things from the media. Um, I think also the reality of, like, caregiving is so much a gendered role, especially if we look at media. And there's a lot of internalized sexism that goes with that as well. So when we think of, like, what are the attributes and the qualities of a caregiver, where we start to set our expectations for that, there's a whole lot of misinformation that we're using to create that. And when we're really rigid, when we're saying, okay, caregiver is selfless. If I go to that spin class, then I'm not being selfless. I'm not being a good caregiver. And so I'm not going to go. When we're really rigid with it, it tends to lead us to be less self-compassionate and can snowball to a bunch of other negative outcomes. Some of the things that I would say I work on most in therapy are these personal beliefs that people have. And two really stick out around caregiving specifically. So one is perfectionism. And then the other one is sole responsibility, or I have to be the one providing the care. So perfectionism, again, strive to be perfect. Great. Sounds wonderful. And given the role, given the importance placed on the role, some people get very, very bogged down by the need for perfectionism. We talked at the beginning about how caregiving is an act of love, and caregiving is a very beautiful act of love. And so we want to be great for somebody. If we're loving them, we want to be good at that. We want to be a good caregiver. We want to be a good spouse. That's why we're doing this, taking care of somebody. And when the stakes become that high, for two reasons. One, because love is a very strong emotion, but another very strong emotion is fear. Probably the two big, if we look at neurological responses to emotionality, love and fear, our brains are going crazy. Like there's so like that, those are such intense emotions. And so if we're afraid of what is going to happen and we love this person, it makes sense that we would be kind of rigid in this role and that we would strive for perfection to a point that can actually be unhealthy sometimes. So we do see a lot of perfectionism of, if I don't respond perfectly, or if things aren't as clean as possible, a higher standard than before, that can lead to less self-compassion. The other one is being the only person who can provide care. And this is different from social isolation. This is more of a belief of I'm the caregiver, this is my role, and there's a whole lot of reasons why we wouldn't ask for help. One is I should be able to handle this. One is, what does it mean to ask for help? A lot of times people have rules within families about parents don't ask their kids for help. They're independent, they have their lives, they're launching their kids, their family. I can't ask for help. That's not what a parent does. And so now I strengthen this belief that I'm the only one who can provide care. The other thing is people will say I'm no one's gonna do as good a job of caregiving as me. And I'm like, maybe, probably, yeah, like that could be true. And the more you wear yourself out, the less you're going to be good at it. And then at some point that might not be true anymore. So there's a lot of, again, rigidity that can breed this belief of I'm the only one who can provide care for my loved one. And that leads to less self-compassion. And then there's a whole other tons of other reasons why we might be less compassionate about ourselves. We might, it might go back to self-image from decades and decades ago. It might be that we just don't have time or energy or social support to be an outlet for this. So there's a whole lot of reasons why we're not those three things on the previous slide. And that's okay. These are the things that we learn along the way and have to work through. So I want to give a couple of pragmatic tips about how we can increase those things, or how we can navigate some of these barriers to be more self-kind, embrace the common humanity, and not spiral. And these have to do with our thoughts. I love thinking about thoughts. I think people's thoughts are fascinating. They are unhinged a lot of the time, and we give them so much power sometimes. So a couple strategies to think about, again, narrowing in on your thinking processes in these particularly periods of high stress when we're caregiving. So one is just checking yourself for self-kindness. So if you're beating yourself up, if you're noticing that you're feeling guilty or that you're doing a bad job, you might ask yourself, is this how I would talk to a friend? And reminding yourself that you really do deserve the same respect that you show other people. If you are willing to accept somebody else's challenges and validate them, then you are no different from that person, and most people would validate yours. So you should get on board with validating those challenges. So check yourself and ask yourself, am I treating myself the way I would another person? You don't have to hold yourself to a higher standard. Second one is thinking beyond yourself. So reminding yourself that you're not alone in this, that other people feel this way. Like these emotions are, one of the other things I like to say is that emotions have evolved with us. So there's a reason. If these emotions didn't serve us as humans in some way, we wouldn't have them. So that anger, that sadness, that guilt and shame and all the negative emotions that we never want to feel again, they have evolved. And so they are a part of the human experience. Other people feel them, and other people feel them because they are serving us in some way. They're adaptive. And so reminding yourself that I'm feeling sad, other people are feeling sad in this situation too. Other people probably feel isolated. Other people probably feel guilty or resentful or angry or excited. Um, and also people are imperfect and we're always learning. And uh, you know, they say like they don't give you like a book. You didn't learn how to, to take care of somebody with a, chronic health condition. I missed that lecture. I don't know. I don't think they give you a guidebook on how to do it. So nobody else has a guidebook on how to do it. So we're all imperfect. We're all learning along the way, and we are learning and we're developing. But that is another human experience of learning and making errors, trial and error. I think the best advice would be to approach with curiosity rather than judgment. So if we're evaluating our thoughts and emotions, way better to be a detective than a judge. Best question, like best one word in my book is why. So thinking why did I act this way? Do I need more help? Do I need a break? Do I like what do I need? Like why did I have this emotion? Why did I get frustrated? Um, and then the other thing is like, why am I being so critical of myself? Like, what am I setting unrealistic expectations? Am I feeling bad about myself for something completely unrelated to caregiving? When we can, again, be curious and approach our thoughts and our feelings with this why, we can learn a whole lot, and that's how growth happens and we can grow. But if we're immediately judging ourselves, we're like, oh, anger, here's the verdict, bad, you're awful, then we're not really actually learning and growing from that. So we really want to reduce that spiral. We want to be curious. So the other thing, so there's supports for emotional health. So there's a lot of options out there for care partners. And so these range from a lot of different topics. I run a clinic here at Mass General where we're doing specialty mental health. Michelle talked about some programs that she runs. So there's a lot of different needs that people might seek help for. So one is education and training. So thinking about, just learning more about the disease, learning more about caregiving. The more that we can learn and just figure out what's ahead of us, we can naturally problem solve. So sometimes that's all we need. Sometimes we want more like support groups. So this could be a great opportunity to get some social support, to learn that other people are going through this. Maybe you bounce some ideas off of others. But support groups can be a really great place for people to get support. And again, just remember that they're not alone. A lot of times case management and coaching can be really helpful. Thinking about, identifying what your needs are, how to approach certain problems and challenges, and figuring out like what can be helpful for those problems and challenges. A lot of neurology clinics will have this. There are programs that specialize in case management, coaching, around dementia care, because it's also a fragmented system. It's really hard to navigate. It's good to have an advocate on your side. And then the last one is psychotherapy, and that's what our clinic at Mass General does. So we really focus on high levels of distress, so high mental health needs. Thinking about the people who have really challenging emotions that are impacting their health. So when these emotions, again, are making you not sleep or not take care of yourself or having really, really high emotional and mental health challenges, then it might be worthwhile to seek some mental health support. And so this is our clinic. So I'm happy to, if you want to put the website down, it's our phone number and email address. So I co-direct a clinic at Mass General where we provide specialty psychotherapy services for caregivers. And so if you or someone you know might benefit from this service, please feel free to reach out to us. We do have a wait list, and right now we're really only able to take folks who are in the MGB system. So if you have a neurologist or a primary care physician at MGB, the best way to get connected with us is to just let them know, and they should know who we are, and they can give us a referral. But if you or someone you know could benefit, we know what works. We have services. We want to make sure that everyone can get connected to those services. And so please do reach out. We're hoping in the future to get more funding to open our services up more broadly outside of MGB. And so I apologize, right now we're just in the system, but there are many resources out there. And so don't be afraid to ask for help. And so that is it from me. I'm going to stop sharing, and I'd really like to be able to answer some questions.
In the meantime, we did get one question. So someone asked, is there a clinic for caregivers of adults with intellectual disability and autism spectrum disorder?
That's a really good question. I'm sure there are. NAMI, the NAMI and SAMHSA are two national organizations that are really great, where they have a lot of support groups and they list support groups. So NAMI is National Alliance of Mental Illness, and SAMHSA is the Substance Abuse Mental Health something else organization association, but they have websites that will list resources by state. The other thing is, in Massachusetts we have a caregiver program, and so there is I believe they compile resources for any family caregivers, and so that's through so I don't know how if there's government issues like with shutdown of accessing them, but if you go to the Massachusetts Family Caregiver Program, they have great resources. They have a phone number that you can call to get connected in your community. And usually there are support groups for folks with intellectual disabilities.
Good to know. Someone did also mention that their dad almost chases everyone out. I think this was just when you were saying like having someone to come in and help you out if you are facing that burnout. Like he gets upset when they're not home for more than 2 hours. So is there a way that someone could set themselves up for backup, especially if there are set boundaries from the person that you are giving care to? Like, is there a way that they're able to, I don't know, instill like a sense of trust into that person, or especially if maybe they're really reluctant to it?
Yeah, so this is definitely something that we deal with a ton. And it is challenging. There's like a lot, and there's a lot of reason, like thinking about like the why, like what are some potential reasons why this might be going on. So there's not one solution that fits everything, but I think it's worth trying, and we know that it takes a while to change a routine. So I think it's usually like people say like 6 weeks. I don't know if that's like data driven, but like I think that's like a good rule of thumb. I think if you add cognitive impairment on top of that, it's going to take a little bit longer to establish a new routine. So someone may be resistant and might be saying I don't want this, and they're not sufficiently giving it, it's not sufficiently routine yet. So I would say to keep at it. The other thing around that is, sometimes, again, we want to be the best caregiver. We're doing this because we want to give this other person quality of life. And when they're upset and saying, I don't want this, I don't want somebody in my home, then we are like, okay, I'm going to push back because that's not giving them quality of life. Um, but I would reframe that. We know that respite care, if you look at any dementia care program, any caregiving program, respite is going to be the first thing people are saying. Like, there was a huge program through the ACL like 15 years ago that was just like, everyone has to like have access to respite care, like nationwide. Like, we know that respite is so important for caregivers and for this illness. So if we think of it that way, respite is the recommended treatment. So if I break my arm, the recommended treatment is for me to have a cast. And if I'm saying, if I break my arm, I go to urgent care and they say, okay, well, yeah, we're gonna have to put a cast on it. It's broken. And I go, no, I'm not gonna do that. And they're like, but your life's gonna like, you're gonna be in so much pain. Like, you need a cast. It's not gonna heal. And I'm like, no, I don't want a cast. Somebody would probably be like, Evan, what are you saying? Of course, like, get the cast. Like, you need to get the cast. They're not gonna let me leave urgent care because they're being like, you're acting like, no, like, this is what the treatment is. It makes sense. um, we don't usually look at it that way for other people. And so I would reframe it to, when somebody's declining what we know is the optimal level of care, we need to push, and we need to also maybe think like, is this person having the capacity to make this decision? Because this is the recommended treatment. Caregivers need it. You will be a better caregiver if you have respite. And so, just like you would if if somebody fell and were like, I don't want to go to the hospital, and they're bleeding from their head, some that would be a safety risk. And so you're probably not going to let them make that decision. I would liken it to this situation that, maybe that's not a decision that they make, and maybe you meet them halfway of what that looks like.
That makes a lot of sense. Thank you. We actually have two from one more person. So Danny says, good information, thank you. Is there a cycle for self-compassion among caregivers? Put another way, when do these qualities appear?
Hmm. So I think it's it's person to person. Some people usually will, like, some people might just have this. These aren't just specific to caregiving. So some people um this is just how they approach life, which is great for them. I haven't met too many of those people. But I think that it develops through, it can either develop through support from somebody else, or it can develop through kind of learning on your own and learning what works. And people who are paying attention to, when I do this, I feel this way and bad. If I do this, I feel this way and good. And they start to change their behavior around that. But I think that it when we are when we cope, when we're healthy copers with emotions, we take that into caregiving and we cope with those emotions healthily. When we have challenges, when we have some unhealthy coping strategies, we take those into caregiving and we have unhealthy coping strategies. So, I think that it really is an individual by individual basis, and some people already do it. They don't have to learn it. Some people never learn it. So.
Right. And are you finding differences among caregiver relationships? For example, are children more compassionate than their spouses? Or than spouses, sorry.
Oh my gosh, yeah, this is such a good question. It's something we talk about a lot. So as a like interesting aside, in my research, I do dyadic interventions. So when somebody has an injury and is rehabbing in a nursing home, I enroll them and their care partner in an intervention together. And so it's not a couples therapy intervention, it's what we call a dyadic intervention, where it's two people who are affected by the same stressor and they're having to work together to navigate, the stressor and care transitions and stuff like that. So pretty much all of this research has been on spouses, like couples where one person develops an illness and then the spouse is caring for them. In my sample, we actually just recently enrolled our first spouse. We've enrolled probably like close to 40 people, and it was mostly adult children, but we got a lot of siblings, a lot of friends, non-family members who are in this caregiving role and who are also saying, I want to help out and engage in therapy. I want to be a better caregiver. I want to have these conversations and are benefiting from the intervention. So I think on the one hand, if you're a neighbor who's, going to Costco and picking up groceries for your neighbor, you're a caregiver and you're part of that care ecosystem. And so you really deserve a seat at the table. And this is also caregiving is a relational situation. You're all caring for somebody that you know. So of course the relationship has a huge impact on that. It is very different caring for a parent, an adult parent, than it is for a spouse. There's relationship uh, norms that you have to, work through in that situation. Same with siblings and friends. So I would say caregiving, the stress of caregiving affects anyone, like regardless of their relationship. Same thing with the benefits of caregiving. It affects anyone regardless of their relationship. Um, and the history of the relationship is of course going to show up. Like if I fought with my mom all the time when she like if I felt like my mom never complimented me and she always criticizes me and it really makes me upset, and now she has Alzheimer's and she does the same thing, of course that's going to come up, and of course it's going to impact our relationship. And it is definitely different for spouses and adult children.
Thank you. We actually do have one more question. Polly asks, are there any recommendations for educational sources for Alzheimer's?
Yeah, I think the Alzheimer's Association does a really good job. They have just like a ton of resources. They have been compiling them for a very long time. They're a very trusted source. So I do think that like I definitely support them. I also think, going to different healthcare systems and thinking about like where do you get your care. And usually there's some type of website there that will provide also local resources. So at Mass General, we have the Dementia Care Collaborative, which kind of bridges a few different neurology clinics, and they have educational resources and also some case management to connect you with different people in the hospital. But a lot of care systems, Tufts also has a really great program in Tufts Medical Center, their healthcare plan. They have a lot of resources, and so I would recommend the Alzheimer's Association, then also looking at wherever you get your care.
Awesome. And I think that kind of puts us right on time. So yeah, I want to thank you again, Evan, for this very informative presentation. There's definitely a lot of information I'll be taking back to my loved ones who are in sort of similar scenarios, so I'm glad I'll be able to share this with them. And thank you, Michelle, for partnering. Thank you, everyone, for joining, and I hope you have a good rest of your night.